Hey everyone, and welcome back for another deep dive. Today we're going to be looking at a connection you might not expect, the link between common medications and your risk of fractures.
Yeah, it's really interesting, isn't it? I mean, we all know somebody who has broken a bone at some point, right?
Oh, yeah, for sure.
But we don't always think about how the medications they're taking could actually be playing a role.
Right. We're going to be unpacking some research today on everyday drugs that you probably have in your medicine cabinet right now. Things like NSAIDs, ibuprofen and naproxen. We'll also be talking about antihypertensives, those are blood pressure medications, and even glucocorticoids, which are steroids that are used for a lot of different things.
Mm,
And then, just for fun, we'll take a look at how a surgical staple, something called tranexamic acid, can impact bone healing.
okay.
And then, just for a little bit of a twist, we'll touch on an herbal remedy.
Oh, wow.
And we'll see how traditional knowledge sometimes intersects with what modern science is finding. So are you ready to dive in?
Absolutely. Let's get into it. It's fascinating because we often think about broken bones as just accidents, but the truth is there's a lot more to it.
Yeah,
Our medications can really have a surprising impact on bone health, and so understanding these connections is just so crucial for making informed decisions about our health.
totally.
Yeah.
Okay, so let's start with those NSAIDs, the ibuprofen, naproxen, like the kind of painkillers that a lot of people just reach for without even thinking twice.
Right.
But there's one study that found that people who use NSAIDs regularly actually have a 10.6 times greater risk of stress fractures.
Wow.
10.6. That's huge.
That's not a small jump. That is a significant increase, and it just highlights again how important it is to understand how these medications actually work in the body.
Yeah.
Imagine your bones are constantly under construction, right?
Mhm.
They're repairing these microscopic damages from just everyday wear and tear. And prostaglandins, which are these naturally occurring chemicals in our bodies, they're kind of like the foreman on that construction site.
Okay.
They're directing the repair process. And NSAIDs block the production of certain prostaglandins, which can really mess up this delicate balance.
Interesting.
And that can potentially lead to weaker bones over time.
So if you're an athlete, you're pushing your limits, you're taking NSAIDs regularly, it could actually be making you more prone to injury because it's slowing down your body's natural healing process.
Exactly.
Wow.
Like think about runners or military personnel, people who are putting constant stress on their bones. If they're taking NSAIDs and those natural repair mechanisms are hampered, those tiny microfractures might not heal properly.
Right.
And that's going to increase the risk of stress fractures.
That's a game changer for how we think about these everyday painkillers.
Yeah.
It's not just for athletes, it's anyone who is taking them on a regular basis. It makes you think about that long-term impact on your bone structure.
Yeah, for sure. And it's not about saying that these medications are bad. They obviously have their place, but it's about understanding the potential risks and making those informed choices, hopefully in consultation with your doctor.
Yeah. Okay, so let's shift gears a little bit and talk about something that's commonly prescribed for high blood pressure, and those are diuretics. They basically help your body get rid of excess fluid.
Right.
But they've also been linked to a 2.3-fold increase in fracture risk, especially for older adults.
Yeah, and a lot of that has to do with falls, right? Diuretics can cause some pretty funky side effects. Things like dizziness, lightheadedness, that feeling you get when you stand up too quickly. It's called orthostatic hypotension. That feeling when you stand up and the room just kind of spins for a second.
Yeah.
That can be really dangerous, especially for older adults who might already have some balance issues or weaker muscles.
Exactly. If you're unsteady on your feet and then you add a medication that makes you dizzy, it's kind of a recipe for disaster, right?
Yes, yeah, it's not a good combination.
You're more likely to fall, more likely to break a bone. And I think about all the older adults who are prescribed diuretics for all sorts of conditions. I wonder how many of them are aware of this risk.
Yeah, it's something to definitely consider. And, it's not just falls. Diuretics can also directly affect your bone health by interfering with how your body absorbs calcium,
Oh, wow.
which is essential for bone strength.
So it's a double whammy. It makes you more likely to fall, and then it also weakens your bones at the same time.
Exactly. And there's a lot of research that has shown that there's a gender disparity when it comes to diuretics and fracture risk.
Oh, really?
Yeah. Women are at a much higher risk than men, which is definitely something that doctors need to be aware of when they're prescribing these medications.
That's a good reminder that one-size-fits-all medicine doesn't always work. You have to consider those individual factors.
Speaking of medications with potential long-term consequences for bone health, Let's talk about glucocorticoids.
Oh. These are powerful drugs. They're used for a wide range of conditions from asthma to rheumatoid arthritis, but they're known to have a negative impact on your bones.
Yeah, they can actually suppress bone formation and increase bone breakdown,
Oh, wow.
which of course leads to a higher risk of fractures.
Mhm.
And there was one study that looked at what happens when people stop taking glucocorticoids long term. And there's good news and bad news.
Okay, tell me more.
So the good news is that stopping these medications does reduce the overall fracture risk. However, the risk of hip fractures specifically, that remained elevated for up to 2 years after stopping the medication.
So even though things are getting better, there's still that period where you're more vulnerable.
Yeah, for sure. So during that time, it's really important to take steps to protect your bone health. The study recommended all of those classic bone health strategies, eating a balanced diet that's rich in calcium and vitamin D, getting regular weight-bearing exercise,
Right.
and of course, avoiding smoking and excessive alcohol consumption.
Yeah, good advice for everyone, but especially if you've been on those medications long term. It makes you wonder, for anyone listening who has taken glucocorticoids, what was your experience like? Did your doctor talk to you about these risks? Did you do anything to protect your bones while you were taking these medications? Definitely something to think about and discuss with your healthcare provider. While we're on the topic of these long-term medication effects and bone health, there's another area that's getting more attention, and it might surprise you. We're talking about the gut.
The gut.
Yes, your gut. It turns out that the trillions of bacteria that live in your gut, what we call the microbiome,
Yep.
that plays a crucial role in many aspects of your health, including bone health.
It might sound strange at first, but when you think about it, the gut is where we absorb nutrients from our food.
Right.
And those nutrients are absolutely essential for building strong bones. And what's even more fascinating is the role of these short-chain fatty acids, or SEFAs. These are produced by bacteria in your gut when they ferment dietary fiber.
Wait, are you saying that the fiber I eat affects the bacteria in my gut, and those bacteria then produce things that can affect my bones?
That's exactly right.
Whoa.
Yeah.
Okay, that's mind-blowing.
It is. They interact with specific receptors in your body that can influence bone cell activity. They can actually impact how your body builds new bone and even how much fat is stored in your bone marrow.
So eating lots of fiber, having a healthy gut, could actually be good for your bones.
Exactly. Research is ongoing, but it's becoming increasingly clear that the gut-bone connection is a two-way street. The health of your gut can influence your bone health and vice versa.
This is why I love these deep dives. We're constantly uncovering these unexpected connections. I love learning this stuff. It just makes you appreciate how complex the human body really is.
It really does. It highlights the importance of having that holistic perspective, right?
Yeah.
We can't just focus on treating isolated parts of the body. We need to consider the interconnectedness of all of our systems and how seemingly unrelated factors can have these far-reaching effects.
Absolutely. And speaking of those unexpected connections, let's take a quick look at a medication that's often used during surgery. It's called tranexamic acid, or TXA. It's great for controlling bleeding, but researchers wanted to know how it might affect the bone healing process.
Yeah.
So they did this two-part study. First, they looked at the effects of TXA on human bone cells in a lab.
Okay.
And then they tested it out in rats with broken femurs.
Oh, interesting.
So did it mess with the bone healing in either case?
Well, what they found was actually quite interesting. So in the lab setting, they saw that the effects of TXA on bone cells were dose-dependent. So at lower concentrations, it actually seemed to boost cell activity,
What's good?
which is a good thing, yeah. But at higher doses, it started to become toxic and actually interfere with bone mineralization.
So too much of a good thing can be bad, right?
Exactly. Moderation is key. And then when they tested it in the rats, the good news is that TXA didn't seem to hinder the overall healing process at the doses that they used, which is similar to the doses that are typically used in surgery.
That's good. That's reassuring.
Yeah. So it seems like it's safe for bone healing at those typical doses.
Okay, phew. This whole study, though, just underscores something that we've been talking about this entire time. Even medications that seem totally unrelated to your bones can have these surprising effects.
Yeah, absolutely. And it really reinforces the importance of understanding not just what a medication does, but how it might interact with the different systems in our bodies.
Exactly, that holistic perspective. Speaking of holistic perspectives, let's switch gears for a moment. Let's talk about something totally different, herbal remedies.
Herbal remedies, okay.
Now, before we go any further, I just want to make it very clear that this is for informational purposes only. It is not medical advice.
Got it.
We're just looking at an interesting example from this book called The Lost Book of Herbal Remedies,
Okay.
which takes a more traditional approach to bone health. So what's intriguing about this particular formula is that it uses a blend of herbs that target multiple aspects of bone health. For example, it includes horsetail, which is a natural source of silica. Silica, what's that?
Yeah, silica is a mineral that actually plays a really crucial role in bone strength and flexibility.
Oh, okay. So this herbal remedy is using minerals to help build strong bones. That makes sense. Modern science has shown us how important those minerals are, too.
Exactly. And the formula also has nettle leaf in it, which is packed with calcium, magnesium, and vitamin K, all essential nutrients for building bones.
And we know from modern research that calcium and vitamin D are super important for your bones right now. So there's definitely some overlap between what traditional healers knew and what science is now confirming.
Absolutely. And it goes even further. So this formula also includes herbs like turmeric and ginger, which both have potent anti-inflammatory properties.
Right.
And remember how we talked about the potential negative effects of NSAIDs on bone healing?
Yeah.
Well, these herbs might actually help mitigate those effects by reducing inflammation.
So this ancient remedy was basically doing what NSAIDs do, but in a more natural way.
Kind of, yeah. And there's even more.
Oh, there's more?
There is. The formula also includes ingredients like dandelion root and inulin, which are prebiotics.
Prebiotics.
Yeah, these are basically food for the good bacteria in your gut.
Wait a minute. Are we back to the gut again?
We are. Remember how we discussed the role of the gut microbiome and those short-chain fatty acids, or SCFAs, in bone health? Well, a healthy gut microbiome is essential for producing those beneficial SCFAs.
So this ancient herbal remedy was tapping into the gut-bone connection way before modern science even knew it existed.
It really is a striking example of how traditional wisdom and modern science can converge. And while we're not endorsing this specific formula, it does highlight the importance of considering a holistic approach to bone health, one that addresses not just the symptoms, but those underlying causes.
Absolutely. And if you're interested in learning more about herbal remedies, I highly recommend finding a qualified herbalist who can guide you safely and responsibly.
That's great advice. It's really important to approach herbal remedies with the same level of caution and consideration as you would any other treatment.
All right, that's it for part 1 of our deep dive into medications and fracture risk. We've covered a lot of ground today, but there's still more to explore.
Yeah.
We'll be back soon with part 2, where we'll delve even deeper into this fascinating topic.
Welcome back to our deep dive. Before we move on, I was thinking about that 2-part study on tranexamic acid, that TXA,
Right.
and its effect on bone healing. It's a medication that's often used during surgeries to control bleeding, but as we've seen, medications can have these unexpected effects on other parts of the body.
Yeah, and I remember you were saying that they tested it out on human bone cells first in the lab. What exactly did they find?
Well, they discovered this really fascinating dose-dependent effect. At lower concentrations, the TXA actually seemed to boost the activity of those bone cells, so that's a positive.
That's good.
Yeah, but then at higher doses, it started to become toxic and actually interfere with bone mineralization.
Ah, so too much of a good thing can be a bad thing.
Exactly. Moderation is key. Of course, cells in a petri dish can only tell us so much.
Right.
To really understand how TXA would affect bone healing, you have to see it in action in a living organism.
Which is where the second part of the study comes in, right?
Exactly.
Testing it on rats with broken femurs.
That's right.
So were those rat bones able to heal properly with TXA in the mix?
Well, that was the question they set out to answer. They compared the healing process of rats who received TXA after a femur fracture to a control group that didn't get the medication. And to evaluate the healing progress, they used a special scoring system and even micro-CT scans, those super detailed X-rays,
Oh, wow.
to look at the bone structure over time.
So what was the verdict? Did it hinder the healing process or not?
Well, the good news is that both the TXA group and the control group showed significant improvement in their bone healing. There were some subtle differences, but ultimately, nothing statistically significant.
Oh.
TXA, at the doses they used, didn't seem to have any major negative impact on how those bones healed.
That is good news. That means that people who might need TXA during a surgery can feel a little bit better knowing it's not going to mess with their bones healing.
Exactly. More research is always warranted. But this study provides some pretty reassuring evidence that TXA can be used safely during the surgical procedures without compromising bone health.
This whole conversation has really highlighted how complex our bodies are.
Oh, absolutely.
It's like this intricate web of systems all working together, and even the slightest tweak in one area can have these ripple effects elsewhere.
It really emphasizes that need for a holistic perspective when it comes to healthcare,
Yeah.
right? We can't just focus on treating the symptom of a particular condition in isolation. We need to think about the whole person, their lifestyle, their medical history, and even the potential interactions between all these different medications and systems within their body.
And that emphasizes the importance of good communication with your healthcare providers. You shouldn't be afraid to ask questions about the medications that you're prescribed
Oh, absolutely not.
and the potential risks and benefits, especially if you are concerned about your bone health.
Absolutely. And you know what? Knowledge is power. The more we understand about our bodies and how those different factors can influence our health, the better equipped we are to make choices that are going to support our well-being.
I love that. Knowledge is power. So we've explored the connection between some common medications and that fracture risk. From those everyday painkillers to those powerful drugs like glucocorticoids. And then we even took that little detour into that fascinating world of the gut microbiome and how it impacts our bone health.
And we even saw how traditional herbal remedies can sometimes offer a different perspective on health and healing, using ingredients that actually align with modern science.
It's amazing what you can learn when you approach health with an open mind, right?
I think so.
And a willingness to just kind of explore beyond conventional thinking.
Welcome back to the show. It's amazing how much we've covered in this deep dive into medications and fracture risk. We've really gone from those everyday things, the NSAIDs, the diuretics, all the way to how the gut microbiome can affect our bones.
Yeah, it has been quite a journey. It really just shows how much there is to learn about how our bodies work and how things we might not think are connected can actually have a big impact on our health.
Yeah, it's been eye-opening for sure. And you know what? I'm still thinking about that herbal remedy we talked about.
Oh, yeah.
The fact that sometimes that traditional knowledge lines up so well with what modern science is finding. It's pretty fascinating.
It is.
Makes you wonder what other hidden gems are out there in those old traditions.
All right. Like, what else can we learn?
Yeah. It's a good reminder that we can learn from both those traditional and modern approaches.
Absolutely.
They both have so much to offer when it comes to health and healing. It all comes back to being proactive and informed.
We've seen how medications, even the ones we think of as harmless or that we take all the time, can have those unexpected consequences.
For sure.
Especially for our bone health.
It's that holistic perspective we keep coming back to.
Yeah.
It's not just about treating the symptom or the condition. We have to think about all the systems in the body, how they're connected, and how the choices we make, everything from the meds we take to what we eat, can affect us.
So what can our listeners do with all this information? What are the key takeaways here?
Well, I'd say the most important thing is to talk to your doctor, your healthcare provider. Have those open and honest conversations. Don't be afraid to ask about the risks and benefits of any medications you're taking.
Especially if you're worried about your bones.
Exactly.
Yeah.
It's your health. You have the right to know and to be part of the decision-making.
Absolutely. And knowledge is power.
It really is.
The more we understand our bodies and how different things affect our health, the better choices we can make. So as we wrap up this deep dive, I want to leave you with something to think about. What questions has this raised for you about your own medications or even the medications of your loved ones?
That's a great question. Maybe it's time to chat with your doctor or do a little research,
Mm-hmm.
or even look into some alternative approaches to health.
Whatever you choose, I hope this has empowered you to be more involved in your own health journey.
Me too.
Remember, stay curious, stay informed. That's the key to a healthier and more empowered life. And as always, keep exploring this incredible world of medicine and the human body. Until next time, stay curious, stay healthy, and keep on diving.